Welcome back. We're answering your questions about the coronavirus in kids with Dr. Nicole Chandler, pediatrician at the Rice Center. All right, this person is texting, if my child is exposed to the virus at daycare, should I, the parent, get tested?
Okay, I think that's a really good question. So the first person I guess I would test would be child, since they were the one exposed. There's a way we think about if you're the contact or what we would call the contact of the contact. And so first person we would test is the person who was in contact with a COVID positive patient. Then if that child who was in daycare with a COVID positive child was positive for COVID, then yes, I would test parent, because we want to know who else positive and what are the chances that we're spreading it.
Okay. This person says, are the chances of getting the virus the same for children as they are for adults?
It's also a good question. Smart people are texting in today. So young kids appear to not be getting the virus as much as older kids. The age range where we see that kind of change is 14 and older. The young kids seem to not only be getting it less, but also for the most part be doing a little bit better. But we're getting more and more data in on that as all the children's hospitals are coming together and sharing data with each other.
All right, this text question says, can you still breastfeed if you've contracted COVID if you wear a face mask or you feed the baby pumped milk? Does the virus transmit through breast milk?
So that's a great question. And we are continuing to encourage moms to breastfeed while wearing a mask. I would have to look. I have not seen anything about transmission through breast milk. And what we do know and what we're encouraging with breast milk is that we're transferring of antibodies through your breast milk. So all the data we have so far is showing, as breastfeeding always is, protection comes from breastfeeding. It's definitely good for babies.
All right, this text question says, with kids going back to school and kids not showing symptoms as aggressively as adults, should kids who live with their grandparents or older adults be tested regularly just in case?
So, think about the one thing we have to remind ourselves as parents is that schools are opening in the same way that other places are being opened, which is with full COVID precautions, right? So your child is in school, your teachers are encouraging washing their hands, wearing a mask, social distancing. We would anticipate that that already is lowering their risk for getting COVID. We also know that young children don't seem to be quite as susceptible to getting it as the older kids. And it turns out they don't seem to spread it quite as well as the older kids. So having them repeatedly tested is I don't think it's going to tend to be that useful. And getting tested for kids is not necessarily fun for the child or the family. I think we need to just really try to encourage hand washing, mask wearing, social distancing, and the same when they come into the household.
This question is, should we be concerned about long-term effects on babies and kids should they get it, even if they are asymptomatic?
Oh, okay. That's it. So if a child has it, do we need to worry that they're going to have a long-term effect? I think we're all across the country, the world, learning. Right now, we're still learning about acute COVID. Right? What are the symptoms that we have when we currently have COVID? And as we're getting further into this pandemic, learning, are there long-term consequences? And so I think that question is yet to be answered. I think there might be probably a little bit more information available in the adult literature right now than in the children's literature, which is a good thing. Thankfully, in the pediatric world, we have had a little bit less experience with kids having COVID. We've had less numbers overall nationally, but it's something that we'll be continuing to learn about.
All right, your big takeaway that you want parents to have right now with their kids going back to school?
I think the big takeaway would be to just feel good about the decision you're making. We're making hard decisions right now, and we're all trying to do our best for our families. Role model good behavior. And when I say good behavior, just, wearing your mask, encouraging them to wash their hands, teaching them how to be social distance, but yet not be in fear, not be fearful. Let this continue to be a joyful time. And as we all know, get outdoors.
As best you can. Thank you so much for joining us, Dr. Chandler. We appreciate it. Thank you for your text questions.